Welcome to Inside Aesthetics, the world's leading podcast for injectors and aesthetic businesses. I'm Dr. Jake Sloan, an aesthetic doctor with over 16 years experience in facial aesthetics.
And I'm David Siegel, an entrepreneur and business mentor with over 20 years of experience in our industry. Our podcasts are aimed at industry professionals, and any information or advice given is general in nature. You should consult with a healthcare provider before undergoing any treatment.
You can also subscribe to us on Patreon for on-demand content for injectable and business education. Good afternoon, David.
Good afternoon. It's Sunday. We don't do many Sundays anymore.
We do not, but it's always good to get a masterclass under our belts.
Yeah, and we're both battling the flu at the moment, so we may not. Well, I think we'll still be on our A game. We've done 300 now of these, so
we'll be good. We'll be good. But if we do cough, splutter, vomit, whatever, we apologise. We'll edit it out.
Well, speaking of 300, we've got our competition now live for the big event.
Yes, so there's still a few more days to apply to our competition. So essentially, we're giving a big giveaway to one lucky winner in the world to fly all the way to Canada to the Canadian Aesthetic Expo, which is a big conference in Toronto.
Yep.
David and I will be there.
Yep.
David's doing his own talk or talks. Same for me.
Well, there might be a live podcast.
And there will be a live podcast on stage, which is cool. You'll obviously get your accommodation paid for. It's a 4-day event.
And flights.
And flights, yes. It's a very cool event. Day 1 is a cadaver lab. Day 2 is a business workshop. So David will be heavily involved in that. And then day 3 and 4 are your traditional conference with lectures. So one lucky winner will win that. All you need to do to apply is go to our Instagram that was posted on May the 16th when we did episode 300. All the instructions will be there. And you just apply and we will pick the winner. I think it's June the 16th.
Yeah, we'll do an Instagram live. I'll actually be in Europe at the time, so we're going to try and tee it up so that we can actually be there together when we announce it.
Yeah.
So jumping into today's episode, it's actually chapter 4 in our Masterclass series, and we're talking about a brand new product here in Australia. We're talking about a product called Structura, which I guess is, well, the big brother product, I guess, of the well-known product Profilo.
Yeah. And we're joined today by some very special guests. And the reason we're recording on a Sunday is because everyone's on a different time zone. But we'll start with ladies first. We've got Ellen Selkon. She's a doctor based in Auckland, New Zealand. And we've got plastic surgeon Dr. Eyal Kramer all the way from Tel Aviv in Israel. Now, Eyal, tell us what happened 10 minutes ago.
You know, we planned for Sunday because it's my working day. And thank you for allowing me to do it on Sunday morning. I'm a bit, let's say, confused because we just had sirens because of missiles coming from Yemen. It's interesting days here in Israel, but we are strong people, and at the end there will be peace. For sure there will be peace, and because the minute we'll understand that love is the power, everything will change. I believe in my people.
Yeah.
Let's pray for good days.
Totally agree.
No, absolutely. Eyal, whilst you're talking, tell us about your own background. What do you do? And what's your association with IBSA, who make Profilo Structura?
Yeah. So I'm a plastic surgeon, a certified plastic surgeon, seated here in Tel Aviv, in Israel, for almost 15 years now. Oh my God, I'm getting older. I became a KOL of IBSA when they launched Profilo, the first product. And after 1 year of playing with it, I understand that they're really innovative. It's a good company to work with. So I moved from other company. I was a KOL, and now I'm ambassador of IBSA. Ambassadors mean that they involve us also in the production and the protocols. So we meet every year, all the ambassadors. We are already something like 20 or something from around the world. And we sit together and we compare our off-label techniques. And by this, we give our colleagues the new protocols and the new understanding of the product, because really, bringing an innovative product to the market is sometimes really hard because our colleagues don't really understand what we have. I think that at the beginning, we also didn't understand, and for sure, IBSA didn't understand what magic they have in their hands. And as the evolvement of the Profilo 64, and now it's 10 years already, we learned a lot. And from this came Structura, because really the innovation is getting better. And the nice thing, and probably we will talk it a lot, and you will hear a lot the word healing, because the main difference with the nanotechnology, it doesn't attack, it doesn't put stress on the tissue, it doesn't create inflammation in order to get the results. It actually heals the tissue from inside. And this thing these days for aesthetic medicine. And nanotechnology also helps in other situations like psoriasis and other dermatology issues. So really, healing is the new phrase now, because the world is moving into healing the tissue instead of, I will not say fighting, because some of the products really fight with the tissue, but mainly not compensating and not recruiting the wrong pathway into natural beauty.
Mm-hmm.
So we have a lot to talk of.
Great. Sorry, Ellen, tell us about your background as well.
Well, I'm a cosmetic physician in Auckland, New Zealand, originally from Cape Town in South Africa. And I've been in the aesthetics business for about 20 years now. And I'm one of the partners at Clinic 42, one of the first cosmetic clinics that was set up in New Zealand. And I've been involved with Profilo since 2020 when it was launched in New Zealand. We had the unfortunate event of launching right in the middle of COVID. So it was difficult days. But it did, it gave us time to sit back and really see what the product could do. So we learned a lot very quickly. And it's been super exciting to be part of Structura launch as well. As you say, the big daddy or the big brother of Profilo. And, it's onwards and upwards. The products just keep getting better. And as we're learning more of what we can do with the products, and as Eyal said, learning just how this new bio-revitalizing is working and bio-remodeling is working and it's all the buzz at the moment. And it's taking us to a new generation of aesthetics.
Mm. Eyal, obviously you're a plastic surgeon, so your original background and training was surgical procedures, and it is quite unusual to have plastic surgeons that venture into such a heavy focus on non-surgical treatments. We've got a very renowned plastic surgeon here in Australia, Dr. Stephen Liu, who's I guess similar in that way. He's right into the injectable side of things. So the obvious question from my perspective is, what was your transition across to, I guess, more non-surgical interventions? As Ellen said, there's a lot of buzz around bio-remodeling. There's been some excitement about old products that have been around for a while that are now getting a lot of attention again. We've got new products like Profilo and Structura. And with that has come some controversy around, are these products a potentially a replacement for surgery? They're pushing back surgery. Some plastic surgeons think there's some downside to using them in terms of what it does for their capacity to perform surgical procedures later. So could you just maybe unpack that a little bit for us?
Yeah. So really, I was let's say, different from my colleagues, because most of the plastic surgeon, and even I, when I finished residency, I said, I'm going to be a microvascular surgeon. I'm going to move flaps and I will build a new face for the patient. And then came the first distributor to my clinic and said, start injecting. And I said, no, this is not for me. This is for dermatologists, for cosmetics doctors. But then I started. And when I came after 2 years to the annual conference of the Israeli Association of Plastic Surgeons, they all call me Dr. Botox. And I said, why do you call me Dr. Botox? And said, because your main focus is injectables. Even though you are doing surgeries, we heard from patients that you really love injectables. And I said, okay, so maybe you should follow me. And they said, no. And after 5 years, all of them, can you teach us? Can you show us? Really, you inject on the cheekbone? You don't inject only the nasolabial fold? I remember my mentor in the hospital saying to me, please tell me why. Why do you do it? It sounds stupid. I said, no, it sounds stupid not to do it. And at the beginning, I was mainly on fillers and botulinum toxin, because these were the main tools that we have for injectables. It was very expensive at that time. I remember choosing patients very carefully. But, and there is a big but, when the nanotechnology came, then I understand that we can change really the aging process. We are not only compensating on the result. We are not filling up what was lost. We can truly change the behavior of the tissue. And also, when I used to take patients for surgeries, I prepared the skin by using before. So if I take a patient for a facelift and I know that I will put a lot of stress on the lateral part of the skin, and also that I will have a scar. So I prepared the patients with the Profilo 64. And by this, I got healthier skin, so I could stretch it a little bit stronger because Israeli patients like it strong. Yes. So, and by this, I showed to myself and also my patient that by preparing the skin, and my colleagues, that by preparing the skin with the right product, it is also easier to do the operation because the tissue separates much more easily if we compare it to other products that create collagen in the tissue. But also the result, the scarring is much better because we are changing the behavior of the cells in the scar tissue. So gathering those two forces, I understand that we should do it. We should combine. Afterwards, I combined before surgery also energy-based devices. So by combining Profilo 64 plus energy-based devices, you get a stronger stimulation to the tissue. So I treat from below with the bio-remodeling. I treat from above and mid-dermis with the energy-based devices. And by this, I can prepare the tissue for the operation. I can tell you it's not only facelift. If we are talking off-label, we can do it for every scar we are planning to do in our body, and of course in the healing process. And by this, I will get nicer scars. I even tried it on keloids, which we really don't like, but we have some. So with keloids, by combining Profilo in the protocol of treatment, yes, I'm still needing the steroids at the beginning at least, but I can use less amounts of steroids, less treatments, and getting much nicer results for a longer time. So I think IBSA brought a magic. And I think that by combining forces and by understanding the way it behaves in the tissue, you can get, think out of the box what you can do with it. And really, every time I go around the world, and I go quite a lot around the world, and I'm sitting with doctors, and they tell me, I did this thing. Do you really think it's the right thing? I said, please explain me why you do it, and then I will answer you, because checking only the results is not always the right thing to do, because we need to remember that our patients nowadays are really young when they begin their treatments. And we need to keep them young, and we don't want to harm the tissue, because we know, for instance, with lips, that if we inject highly cohesive products, we get a very nice and beautiful lips. But there is a big but, like I say, a Brazilian but. We are stressing the tissue, and by this we are changing the volume from natural tissue to something foreign, that is something that we inject from outside, and we will need to inject more and more. And this is why we get more pillow face, very big faces these days. Now the world is moving, so I like to look at the doctors at IMCAS and see how the world of aesthetic is changing. So if 5 years ago it was like a Rocky Horror movie, how do you call it, the rock show, really interesting people coming into the auditorium. Now they are much nicer, more slimmer face, not the wide face, and also doing operations after some of the products are really hard. Some of the doctors, the plastic surgeon, hate threads. I don't hate threads. I think it's a great tool as long as you do it on the right way. But if you're doing it in the wrong way, you create a lot of fibrosis in the tissue. I remember my first patient having a brow lift, and she didn't tell me that she had permanent threads in her forehead. And it was really frightening to do the operation, because you got stuck in the middle of the operation when you try to release the tissue. And when I woke her up, I wanted to kill her, to tell the anesthesiologist to kill her, but I decided that I will wake and shout on her. And she was, I forgot about it. It was 5 years ago. I said, it doesn't matter. This is why, for me, it's so important to use the right tool for the indication I want to give my patient. And even if it takes a little bit longer, it is better to take the right product and to treat with the healing way and not the stressful way.
Yes. Now, it's probably mindful of our audience. A lot of them are in America or some other countries that don't even have Profilo, let alone Structura. So maybe if we could just go back to a bit of history and speak about how Profilo works, because they're very similar, Profilo and Structura, and then we can get on to what the differences. So, what actually happens when you inject Profilo into the skin, first of all?
Okay, so Profilo is HA, it's hyaluronic acid. And what's unique about it is that it's high molecular weight hyaluronic combined with low molecular weight, and it's thermically bonded. So there's no BDDE, no chemicals, nothing. So it's a very natural molecule, so to say. And your final molecule, once it's cooled down, is just this combination of that high and low molecular weight HA. So when you inject it, it mimics your natural HA, the one that mimics it to the closest to any HA that you're injecting. And for this reason, it has a very, very low inflammatory effect in the tissue as well, especially the high molecular weight HA, which is actually anti-inflammatory. So that's the reason why we're using Profilo now, for a lot of skin conditions and off-label, psoriasis, rosacea, all these eczema, all these inflammatory skin conditions that people are suffering with. Profilo is fabulous for that.
Yeah. Once it's injected, the actual little molecules, they call them the hybrid cooperative complexes. They're like little signal molecules, if you like, of individual HAs. And that's the magic. That is what's talking to the fibroblasts and stimulating them. So
correct.
Can you just explain that mechanism? Because it will help us understand Structura.
Yeah. So what's happening there is that basically the hybrid cooperative complexes are stimulating the messengers, and the messengers act on the receptors of the fibroblasts and of the cells and stimulate elastin and collagen, as well as hyaluronan synthase stimulating hyaluronic acid. So you've got this multiple stimulation going on. And it's all the studies have shown that they work through this leptin and adiponectin, increasing those messengers in the tissue. And those are the messengers that fire on the receptors and cause this increase and the messaging of the fibroblasts to create the collagen and elastin.
Right. And for the lay people in the audience like me, how does this differ from traditional HA? I know you're talking about, high, low molecular weight.
Yeah.
The production process is different, but they're both HAs. So what mechanically happens different between injecting regular HA and something like Profilo/Structura?
So when they've actually done studies where they've compared Profilo to high molecular weight HA on its own or low molecular weight, and it's the similar, all HA works on the same receptors on the fibroblasts. So you're still getting collagen and elastin stimulation with normal HA, but it's almost threefold what you're getting with Profilo. So it's accelerated and accentuated considerably.
Yeah, I think what is really different, because HA, it's a name, it's a molecule. So what we have to understand when we are talking about HA is the way it's produced and the way it is stabilized in order to stay in the tissue, because regular HA, the natural HA that we have in the body or in the non-cross-linked product, stays very short time in the tissue. So you get hydration because it's HA, it's absorbed water. But the main difference by stabilizing the hybrid cooperative complex is that we get like a slow natural release HA, which means that we are taking this almost the same HA that we have in our body, only we stabilize it so it will stay for a longer time. And by this, we are changing the environment of the cells, because you've heard probably somewhere in the Facebook or Instagram about epigenetics. Epigenetics is how the environment controls how our genes will be expressed. So by changing the environment of the cells, by creating a healthy environment for instance, for the Profilo 64, it's the dermal white adipose tissue, it's the fat cells that integrate into the skin. We are signaling them, please behave like you're in a young tissue. And they correspond by creating, and we can see it, and IBSA did a lot of research and a lot of publication also about histological and how much adipoleptin and nectin is in the tissue, in the adipocytes, and this is the messenger that will go to the fibroblast and the keratinocyte to create collagen, elastin, but also our natural HA. So when we see the effect on the skin, for instance, with Profilo 64, it's not what we injected, it's what our cell created in response to the treatment. So, there are also other competitors, HA-based product that says that they create collagen. Of course, because every HA you will inject or deposit in your tissue will create eventually collagen and elastin, because this is how our cell behave. The difference is how do we get to this point and how the effect is built for a longer time. Because otherwise we are talking about skin boosters or revitalizing products, but this is really something that bio-remodeling, when we say bio-remodeling, it changes the behavior of the tissue into a healthier way. This is why when you understand this, you can get out of the BAP technique, out of the neck, the décolletage. You can think almost everywhere my patient demand to improve the quality of the skin, I can use Profilo 64. With Profhilo Structura, it's a little bit different because it's a really tailor-made product for the fat compartment, for the superficial fat compartment. But when we are talking about skin, we have difference in the thickness of the skin and the amount of apocrine glands in different areas. But the levels of the skin, the different cells, the keratinocytes, the fibroblasts are the same. The only difference is because if we go for a larger, we need more amount of HA in order to create. So like it's a slow release, Ritalin for our patients with ADHD, that we need it to slowly work all the time so they will have a full day that they can concentrate. The same if with our skin. We need all the time to give the right environment for ourselves that they will do the stimulation. So this is why we're not calling it biostimulation, even though there is a stimulation. But the stimulations come from your cells, not from a foreign product that enters the tissue. For me, this is the main difference when we are talking, and Ellen explained it very nicely. We create the environment to create the stimulation to get the results in our healthy tissue. And this is the closest. This is why we need the long and short chains. We cannot do it either with only the long or either the short, because we want to lower the inflammation effect, but on the other side, increase the amount of collagen and elastin and natural HA in our different tissues, if it's the skin or the fat compartment, which we will talk later.
Great. So we've established what Profilo 64 does, mechanism, and the molecules it is making. So how does Structura differ from that? Because they're the same molecule. So how do they differ?
So you're correct. The molecule is the same. It's the concentration of HA in Profilo Structura that is greater. So whereas Profilo 64 is 32 milligrams per mole of HA, in Structura it's 45 milligrams per mole. So you have a much more robust, and the rheology therefore is slightly different as well. So medically speaking, your tan delta, so your flowability or the liquid of your product it's not as liquid as Profilo, but it still has a tan delta greater than 1. So it's still a flowable product, not a gel, so to say. And the other thing is the G prime. The G prime is higher with Structura than Profilo. So it is a firmer product because it's going in the deeper tissue, in the superficial fat layer, not in the dermis where Profilo is going.
Okay. And so what would the indications be for choosing Structura over Profilo?
So Profilo is a treatment for the skin. Mm-hmm. It's, even though we know it's got this 3D vertical spread, the main effect of it is on the skin, on the dermis. Whereas Profilo Structura, we're injecting it into the superficial fat layer, and what it does is it regenerates those adipocytes, so the fat cells, and it allows them to act like young fat cells, and produce more fat cells, basically, that are young to keep the tissue young. So it's acting in the fatty layer only.
Okay, so Eyal, I don't know if you could explain that a bit further. What is Structura doing on a cellular level? Because we're now not working on fibroblasts, we're in the fat or superficial fat. So what is happening here?
So first of all, I didn't trust IBSA. I tried to check if I can do the same effect with the 64. I took my sister. It was really not nice of me. I got a lot of bad vibes from my mother. What did you do to your sister? Because I really tried half of the face, the same technique with Profilo 64 and the other side with Structura, and the results was totally different. I also tried to do Structura in the BAP technique, which really I don't recommend because it's very painful for the patient, poor sister, but you don't get the same effect because the rheology is different and also the concentration. What Profilo Structura does differently, and this is mainly because we got more HA in this product and also the different rheology. So we address the superficial fat pad, but we address it the same way, which means that we are changing the environment of the fat cells. So when the tissue, the cells feel that they are in a healthier environment, that they will recruit more and healthier adipocytes. It doesn't mean that we will get fatter. This is very important. This is the same biology that we have regularly when we are young. It means that all the time cells are changing. Some cells die and then new cells are recruited. And also the aged fat cells also become healthier because they are in a healthier environment. So you can see it very nicely on some of the publications by IBSA, that you can see that the sugar, the tense on the membrane is better after treating with Profilo Structura. So Profilo Structura is aiming for the adipocytes of the superficial, but as you said, it also, by changing the behavior of the adipocytes, it changes the response of the fibroblasts in the fat compartment. This is why it was Dr. Kara from Australia, yours, that showed a very nice slide that's speaking about a sponge. Because when we know that when we use the sponge for the dishes, with time it gets thinner and, let's say, break. And when we buy a new one, it is very strong, very resistant, very youthful. So the same things happen in the tissue. It's not only the adipocytes that changes. The adipocytes are the target. But when you target the adipocytes, you change the environment, the extracellular matrix, which is the main component that is let's say, responsible for our aging process. And we didn't give it a lot of attention over time because we didn't have anything to work on the extracellular matrix. But these days, when we understand that NICO technology is working on the extracellular matrix, we've gone deeper. But we had to change the rheology because if you will inject Profilo 64, which is really fluidable, tan delta above 1, but also a very low G prime, it will spread, and because we have muscle movement in those areas, the product will spread not in the direction we really wanted. But when we elevated the G prime, it will stay in the compartment that we want. It will stay, for instance, in the lateral fat compartment, and by this it will address the structural fat pad. We have different fat pads in our face and in our body. Some are for structural support. Some is only for, that it will allow the muscle to glide very nicely over the bone. This is the deposit. And for this, we still use regular fillers to compensate. But the future is really interesting. The last one is the fibrotic fat compartment, the fibrotic fat, which is the one that sticks the skin to the muscle. So we will have very nice mimics, but with time we get the breakage and the barcode lines. So for the fibrotic one, we are still addressing it with the Profilo 64 because it is it's smaller area, and we need to improve the resistance of the skin to the breakage. We don't need to improve the quality of the fat in this area. So for Profilo Structura is for the structural fat, and it really changes the behavior by changing the extracellular matrix, and by this we get also more collagen in the fat compartment and elastin, which by this, when we push the skin after treating with Structura, it jumps back. With Profilo 64, we used to tell you pinch the skin to see the fast recovery of the skin. So with Profilo Structura, we are changing the resistance. It's like putting air in a balloon, so it will resist the tension from outside. The same thing, but we don't make excess volume, because when we try to do it with regular HA, cross-link HA, we are volumizing. So we give the fullness, the nice contour, but we don't change the way that the tissue behaves. And this is why sometimes when the patients come, you can even palpate the product inside. With Profilo Structura, even though the G prime is close to a cross-link product that we have, for instance, from Alexin GP, but we have for other brands also, we will be able to notice it when we palpate. And sometimes even when the patient will chew or eat, you can see a bulb coming out and backwards. So this is not the right tool. So we've moved from volumizing, from compensating on the loss of fat by injecting a filler. Now we are recruiting our own adipocytes to behave like a younger tissue. But it is very important the patient will not get fatter. It is not the way to gain weight or something. So, but it is a very important way to fight the Ozempic, the weight loss injectables, because we know that they really ruin our adipocytes. They're ruining the fat compartment. And we know that we have a special phrase, the Ozempic face now, that we see more and more. It is good for the aesthetic medicine, but the patient really don't like it. So these days, if a patient tells me that she's going to get the injections of the Ozempic, I will tell her, prepare your tissue, because you have to fight this process. So we need, at least in the area we want the fat to stay, to use the Profilo Structura these days.
Yeah.
Not wait for the result.
So Ellen, from a practical perspective, when you presented with a patient in front of you and you're doing a consultation, you're trying to put together a treatment plan, how do you choose, I guess, Structura as the product that you need to use? Because we've got HA fillers, there's, the old school bio-stims and bio-remodellers. So what's your sort of, I guess, flow chart of how you sort of make a decision to what product to use? Because that's something that we've kind of been bombarded with so many new developments in the last few years. I think a lot of injectors are starting to feel confused about which tool for which job.
Absolutely. And I think it has become very confusing for a lot of people over the last few years, as you say, with the flurry of, HAs and various products that have come onto the market. So for me, Structura is, when people say to me, whose Profilo or whose Structura is suitable for, it's suitable for everybody, basically, because it's an investment in their future. So we know it has a cumulative effect over time as well. So the longer you use the product, the better your results are ultimately going to be as well. So I try and put everybody onto a maintenance program with Profilo and with Profilo Structura now. So I use both. We do the two together in one consultation, and we call it Lift and Glow. So they have Profilo Structura with Profilo 64 in the same treatments. And I think explaining to them that, especially women in their 30s, in their 40s, whether they're going to start losing that fat component and it's going to start dropping and changing as they reach menopause, they want to invest in that, and they want to try and prevent that from happening, really. So by doing that, it's a no-brainer. It will also diminish the amount of regular filler that they're going to require. So a lot of people, are very into bio-revitalization and bio-remodeling and want to use a product that is as natural as possible as well. And, I don't feel that fillers are out of vogue. I think there's still a place for fillers in the market today. I think they need to be used correctly and injected correctly in the correct amount. And so I still think there's a place for them. But I think a lot of people don't want that done look. And Structura certainly, because it doesn't volumize, because it only acts on that fat cell, doesn't give you that overdone look.
Yeah. And so are there any people who you feel are not suitable for the treatment? And I guess in addition to that, how do you make your patients understand what it is that this product's going to be doing? Because we've been so used to the instant gratification of dermal fillers. I think some injectors potentially struggle with, I wouldn't use the word sell, but getting the patients to understand as you that this is a long-term investment. So can you just walk us through how you sort of overcome that potential hurdle with your patients?
So I try and do a long-term plan with all my patients, and we talk about the here and now, what you want now, what you want to achieve today, and where you want to be in 10 years' time. And if they want to be basically where they are now in 10 years' time, then they need to invest in the future of their skin and their tissue. And, that is with something like Profilo and Profhilo Structura. So a lot of people are very nervous about walking out and looking different to how they look at the moment, and they don't want that. They just want to gracefully go through a process where they look youthful and revitalized without looking done. And I think that's what Profhilo and Profhilo Structura do for you. So I really sell it to them, if we can use that word sell, but explain it to my patients on an investment process, and that you're not going to see any results for a while, and they have to hang in there. But down the line, this is where they, in 2 years' time, 3 years' time, 4 years' time, they're going to come back and they're going to go, thank you so much for talking me into that when you did, because that's when they really, really notice those results. They will, of course, notice the results after the first 2 treatments, but down the line is where they're really going to turn around and thank the injector for it.
Eyal, if I can ask you the opposite question, when would you choose a structural HA cross-linked filler on the side of the face or a traditional biostimulator like Radiesse, Sculptra, etc., as opposed to Structura? This is what I think injectors are really wanting to get their head around.
So for me, I will be honest. First of all, these days I will always start with Structura before I'm doing fillings. This is for me. But there is always a but. Some patients say it's a bit expensive. I don't want to invest so much. Give me the immediate results, even though it will stay shorter than the biological one. And then I will go with fillers. There are patients that I tell them, let's start with Structura and then do the adjustment of the lifting by using the fillers. For the calcium hydroxyapatite, I mainly use it as a very strong filler for bone compensation. So it's jawline, temples for very depleted patient. For the polylactic acid, I will be honest with you, for me, it's not the right way to treat the tissue for our patients. So I tried it because I'm interested in trying new things. And when it came to Israel, I had to try it. So I tried both companies that we have in Israel for the polylactic. Yes, you get a very strong, let's say, tightening effect. But since I understand how it behaves deeply, and I've even operated some patients after it, it is harder to do the operation. So when a patient comes to me and says, in 10 years I will go to the operation, so I tell her, maybe, but not for sure, because now we have different treatments than before. But I'm telling you, so let's respect the tissue. Let's treat it in the right way, in the biological way. So for me, it's mainly, if I will not use an HA, it will be the calcium hydroxyapatite. But very, very, I have to choose the patient really carefully, because we know that we don't have an eraser for the calcium, a real eraser for the calcium or the polylactic. And I'm in charge also for complications of injectables in Israel. So I will be honest with you, you need to be a very good cosmetic physician on using this product. And when you have a problem, you have a problem for quite a long time. And so this is why, this is beauty. This is anti-aging. We need to be very safe with what we are doing for our patients. And if we can use an ingredient that we have anyway in our tissue, let's use the right product. Let's respect the tissue. And I think that HA is really the stronger component that we lose when we age. This is why we need it in order to reverse the process. I'm not against anything, but when I have to choose, and I always think what I will do to my loved ones. My sister, I love her, but I have to try new things on her. So she knows that I love her. So I will go with an HA product. Nowadays, we have also, exosomes, different way to, it's mainly to stimulate or to revitalize, to give the chances for the tissue to have the ingredients that it needs. So I think there is a place for them, especially when we are talking about the superficial part of the skin. But when we are trying to compensate or to slow down the real aging process, which is the loss of volume, if it's bone or fat, muscle, and then the skin, we need to go with the natural product, which is an HA-based product. Still, we need the lips with fillers, we need the nose with fillers. We need, some of our patients comes a little bit late, but also the young ones. Sometimes when they come for the lips, you need to fix the proportion, because if you treat only the lips, it will look like she's done lips. So you need to inject, for instance, if she had a very rectangular face, we need to inject some highly cohesive fillers down to the bone in order to create the nice proportions. So the lips will look like they are her natural. But I will go less and less with cross-link products. I will try and gather the own biology of the patient in order to give her the nice and natural and healthy look that she really wants. Sometimes it's hard to convince the patient, especially when we are talking about a process that takes time. The full effect of Structura is after 3 months from the treatment, because it depends on the biology. Sometimes I will send them to start using complements, collagen complements, so the body will have the bricks to work with. Because if the patient is non-healthy, smoking, not drinking water, not eating healthy food, it's really hard to give her a biological effect.
Alan, can you just walk us through like what a standard procedure looks like in terms of, I guess, preparation, what tools are you using, how much you're injecting, what layer of the skin, how long does it take, post-care, etc.?
Sure. So basically, we book our patients in for half an hour. That's normally after we've consented them and we've been through the whole consultation with them. And the Profhilo Structura comes in a 2 ml syringe, and you also get a box with 2 different cannulas with that, as well as the pilot needles. So depending on how you're treating your patient, whether you're treating them as a so-called sinker or a sagger, determines which cannula you're going to use. So there's a 22 gauge cannula, and that cannula is used for the sinker protocol, and the 25 gauge cannula, 38 millimeters long, is used for the Sagger protocol. So basically, you're going to clean your patient's face. You're going to, have them on the bed, that you're going to clean their face thoroughly, because you are using a cannula. So you want to just protect the hairline as well. And then you would insert the appropriate cannula, and the injecting process is pretty easy and very simple. And I would say the injecting process takes 10 minutes all up. It's best to inject it slowly because it's less painful for the patient. So I always try and inject as slowly as possible and, make it as easy on the patients as possible. But generally speaking, they do not find it, a difficult procedure to endure or to go through. It's, I would say, a pain level of probably 2 or 3 for most people. And once you've finished injecting, we just pop a little bit of the sterile coverage over it and away they go. They will have some lumps and bumps afterwards, and that is the product sitting in that superficial fat layer. So they are warned about that beforehand. But generally within 24 hours, that's subsided and they can go about their normal activities.
So are you injecting boluses along linear lines? Like what, and what layer are you in?
We're in the superficial fat layer. Okay. So we're above the SMAS in the superficial fat layer, and you inject it as one long linear thread, basically. So if you're a sinker, you're going to just do the whole mil on a side as one long thread. You can divide it into a couple if you wanted to. And if you're a sagger, you're going to do half a mil vertically and half a mil horizontally.
Eyal, we didn't quite define sagger and sinker, because that's sort of the on-label kind of way of differentiating these patients. But do you just want to describe what you would see in these people in real life? What's a sagger and what's a sinker?
So a sinker for me is the one that is really depleted on the lateral part. And most important is when I have to decide between a sinker or a sagger, I think of the effect that I'm going to give them. So I'm using my fingers on the patient. I check if this movement is enough for my patient, then I will go with a sinker technique.
So you're if pulling I need back also on the mandible, the skin.
I'm pulling gently, but gently. It's not a facelift. The patients have the three fingers. So I want this thing. Yeah. So no, I put my finger very gently and I pull it very gently to see the direction that I need. So I check if this is enough for me. Yeah. Then I will go with a sinker. If I will have to add another finger here and push a little bit upwards, then I will go with the sagger. Mm-hmm. So this is the really easiest way. We can watch a lot of paces and decide, and we do a quiz. You remember also, we do a quiz when we do the launching, sinker or sagger. But the most important thing is to check your patient, to palpate where are the fat compartments, the structural that they need the support. So I really push the tissue and I pinch it and I feel the quality of the fat in the structural fat compartment, the superficial one. And then I can decide if I need either the sinker or the sagger. And then comes the off-label treatment. So sometimes if I'm not sure, or if I need mainly this, but I feel that something is missing here, or I'm trying to improve the teardrop deformity, then I will go with a modified technique. I will, instead of 0.5, 0.5, I will use sometimes 0.7 to get mainly this effect, but 0.3 to give support here from below. So by this, I can improve also some of the cases of teardrop that we know it's a little bit more complicated because we have higher chances by injecting a dermal filler into the teardrop deformity of prolonged edema or Tyndall effect, and you need to be very experienced physician to do these things. So now that we can, go from behind and effect, get a neighboring effect by injecting Structura, then we can play with it very nicely. Ellen said very importantly, inject slow. It is the right thing for all injectables because the faster we inject, more stress we put on the tissue. But with the Nikon technology, it's even more important because by injecting slow, you let the product integrate faster and spread faster into the tissue. So you will not get the bulbing effect, the noticeable bulbs, but also you will get less edema with every injectables we use. So this is a very important thing that when we are talking about aesthetic injectables, inject it really, really slow. It is a very fast treatment, so you need to prolong it a little bit. And the right way is to respect the tissue and inject it really, really slow. I always turn the opening of the cannula to the fat compartment, so I will know that the product will go in the right place and in a non-noticeable way or a less noticeable way at the beginning. I usually do it in more than one line because I don't want the snake appearance for the beginning, because the patients really demand to get out of the clinic after lunch treatment that nobody will notice that they got a treatment. So for this, we have what Ellen said, the cover-up, the sterile makeup, that also has arnica inside, which is amazing because it lowers the edema afterwards. And if you get a bruising, it also fights in faster absorption. So the cover-up is really nice. And the patient goes out and they see some immediate effect, which is not the full effect of Structura because the G prime is higher. So it behaves at the first 24 to 48 hours almost as a filler, as a G prime 95 filler. So you get an immediate and you can show them half of the face and tell them, this is what you will get after the full effect of Structura will go into action. So they really love it. And on top of it, we get the improvement of the quality of the fat compartment, which means that when you will palpate or kiss the patient, I kiss them after treatment because they demand it. So it is very nice after the second treatment to feel the resistance of the tissue. But always with approval.
Okay. If I could ask you then, Ellen, so if you have a sinker, basically someone's hollow on the side of their face, I think, Eyal, you're a beautiful man, but you're a good example of being, a little bit hollow on the side of under the cheeks, which is, it's fine. But you're not actually filling like a traditional filler. You're just putting the Structura there, mainly in a linear thread, to act as a stimulator of the fat. You're not actually filling like a filler. Is that right?
100% right, yes. So as you said, it's not a cross-linked filler where you're putting volume into that area. It is stimulating those fat cells in that area to regenerate.
Okay, perfect. Now, in terms of the protocol, it's very similar to its little brother, Profilo 64. You do 2 sessions over a month. But why do you do that? Because Eyal said that it's this slow release. It's releasing the hybrid complexes over a period of time. So why do you need to do it again?
Well, my understanding of that is you get a result out of one, but if you had to do, let's say, 4 mils of Profhilo Structura at the same time, it would be too much. So the edema you'd get all the side effects, potential complications, etc. So by spreading it and taking it and putting a month apart, you're allowing the body to start that process of regeneration, and then you adding that second dose to keep going even longer.
And Eyal, do you know if there's any, histology data or otherwise to show how long the Structura is physically in the skin before it's degraded and completely gone?
Yeah, there are numbers. IBSA checked it. It's about between 39 days to 49 days. But it is not how long it stays in the tissue, it's how long the effect on the tissue is. Because the minute we change the exosomatic, some patient needs every 6 months to go through another treatment of Structura. I will be honest with you, most of my patients after 9 months, they demand, not because I really saw that they need it. But if you palpate, you start to feel that the fat compartment is starting to go in the wrong direction. So usually also the 2 treatments, it is, this is the protocol, but sometimes I make it a little bit longer, especially for young patients, especially when we combine it with the 64, because with the young patients that are really only in the beginning of the journey of aging, you need to respect the tissue. So it's not, it's written 1 month apart, so I will do it. But for the majority of the patient, we see that by we know that wound healing process, the one that we are working on with other products, but also a little bit with Profilo, is 3 weeks. So this is why we are waiting for the 3 weeks, the first 3 weeks, to gather the collagen, and then doing the second treatment for a reboosting, for extra effect. This is where the 1 month apart came from, because we wait for the 3 weeks. We know that people are different, so we wait another week and then we do the second treatment, the same like with Profilo 64. So we are respecting the biology, the pathway of creating collagen and elastin, and by this we are doing the 2 treatments for the full effect. But I agree with Ellen. Some patients come after one treatment and we see an amazing result. And then you have to decide, shall I do the second one or can I wait a little bit? So if with Profilo 64, it was mandatory for me for the second treatment. With Profilo Structura, it really depends because patients react differently according to their quality of tissue. So I can play with it a little bit. But the majority of patients, at least at the first treatment, will get the two consecutive according to the protocol. I couldn't think of one patient when I started playing with Structura that got only one, because they fell in love with the effect and they want more. The same with fillers. So at least with Profilo Structura, I know that I'm not, over-correcting or creating the wrong thing for my patient. So it's really easier and it's really safer because it's non-cross-link. I cannot think of a situation I needed to dissolve. No, never, not yet.
So when you're assessing a patient and you're working out how much product do you need, are you using the 2 ml syringe typically for a whole face? How are you actually designing your technique protocol and usage?
Well, with Structura, there is a protocol that we follow basically, and it is 2 ml per face. Mm-hmm. So it's a ml each side. And because you're targeting the structural fat, you're not targeting the entire face. So you are only targeting the mid face and the structural fat in the mid face, because that's where your structural fat is.
Ellen, I think you're the most experienced person in at least Oceania in using Structura, and Eyal, you're probably one of the most experienced people in the world. What have you heard about complications? I know it's rare, especially with a product similar to Profilo, but have you heard anything weird or wonderful that you can share with us?
So the last I checked, which was when I was in Sydney recently, no vascular occlusions to date worldwide. So, that's great news. And I don't know, I don't think that's changed. I haven't heard anything that's changed. In terms of common side effects that we see, you do see some edema in some people, which can last for a day or two, generally not longer at all. But that's probably the most common side effect that you would see is edema and swelling, and obviously bruising because you're putting a cannula into them, and potentially at the insertion point there may be a bruise.
Yeah. Anything crazy in Israel to report, Eyal?
Only when I try to do stupid things, playing it in, saying, oh, it works like this, maybe it will work. So I will be honest with you, with Structura, none, because really the technique is so simple and very safe, because we're using a cannula in a compartment that almost no blood vessels, no nerves, because we are above the SMAS. As long as you respect the tissue and work slowly and gently and not fighting with the tissue, you will not get anything more than edema. I have to tell you that we got from Asian people sometimes that they felt for the first 2 weeks that their face were wider because we injected 1 ml on the side. So we learned from it and we changed a little bit the way we inject the product. Instead of allowing them to do it in a one line of 1 ml, it is for most Asian people, it is almost mandatory to do it in like a fanning technique and inject every line 0.25 or 0.3. So we will not get the widening effect, because when they see the fullness, they feel that their face was wider, and also they get a bit of more edema because we are not the same, different ethnical groups have different behavior of the tissue and different aging process. So we know that from Asian people which have thicker skin, less volume in the face, most of it is either bony or the thickness of the skin. So when we are using Structura and we are addressing the fat compartment, we need to respect it and to do it more gently by doing the fanning technique. We had a very big argument between the ambassadors. Should we go from up or should we go with down? because I was the one from coming in favor for coming below, because then you are stuck in the zygomatic cutaneous ligament, so you will not be able to go upwards into the SUF area, which when we inject HA there, we might get a very unpleasant edema. So we're still arguing between us what is better. But IBSA as a company recommends to go from above, to stop above the belly of the masseter. And by this, you will be very safe, very easy. But we are doctors. We can think out of the box, and in our clinic, we do what we feel comfortable with. The only thing you really need to know is the anatomy, where to expect to find the ligament, not to fight with the resistance. The resistance of the ligaments tells you, stop here, don't go behind it. For Structura, but when we go for the mid cheek, when we do the Saggers technique, we need to wait and to feel that we pass the ligament. This is why IBSA gave us two different cannulas. They gave us the 21 gauge for the sinker, so we will not be able to go easily through the ligaments. For the Saggers, they gave us the 25 gauge cannula, a bit shorter, so we will not be able to go too medially. But on the other side, we will be able to go through the ligaments a bit easier. But still, you have to feel the ligaments of your patient in order to deposit the product in the right place. And it is very nice that we get the cannulas, by the way, from IBSA in the box and not buying it on ourselves, because then we start to think, oh, a cannula is a bit more expensive. I will use a needle, and then we might go either too deep or too superficial, or harming tissue that we are not intending to touch. So this is very nice for IBSA, and they gave us very good cannulas. So I was really excited when they sent me the box of cannulas together.
Yeah, those cannulas, they would save you about $20 a box here. It's not insignificant.
Yeah, and the one you don't use, you could just save and use for something else later.
Correct. No, exactly.
Exactly.
You'll probably only use one per treatment, so you've got a spare one.
Yeah.
Good. If people were wondering, I didn't quite understand the technique or what Eyal or Ellen were saying, we're going to put all of this on our Patreon, so you'll get to see videos or pictures, or maybe I'll even do a play in my own clinic with the product.
Yeah. Now, Ellen, one of the challenges with Profilo was showing the results on a photograph, because we're not talking about huge amounts of volume or sort of 3D changes. And so capturing what a good result looks like has been challenging. Do you have the same challenge with Structura? And how do you sort of demonstrate efficacy? Because, patients sometimes suffer with amnesia.
It's not quite as bad as with Profilo, because Profilo, obviously treating the skin, photography is everything. And, a little bit of different light and everything looks different as well. So with Structura, you are getting lift as well. So lift we can demonstrate generally with a photograph, especially if in that 45 view angle with a photograph. I think that's the view that I use a lot. The other thing that you can demonstrate with Profilo Structura is I always get patients before I treat them. I say, just feel your skin now and push on your skin and feel what it feels like, and try and remember what your skin feels like. But we also take a photo of them holding their skin out, because there is a 23% increase in tissue thickness with Profilo Structura. And that is a palpable effect that people can actually feel. And so I've had a lot of people saying to me, oh my gosh, it just feels so much better now. It doesn't feel like that crepey skin with no tissue underneath it. I can actually feel that I've got some tissue going on there. So that's something that we've started doing as well.
Yeah, if I could add, you can only show them the photos if you take the photos. Lots of people forget to take photos. So please make sure you do, and be as consistent as you can with, lighting, position, hair, and like you said, do the stretch test. I also get them to lean 45 just to show the sag, and just as much as you can, because like you said, David, our patients have got amnesia. They don't remember what happened 10 minutes ago, let alone 3 months ago. So back yourself with evidence. Do you use any other 3D cameras in your clinic, Eyal?
So I use the Vectra one because, I needed it for my presentations, etc. But I think, it's a bit expensive. I will not say a bit, it is very expensive. We have less expensive products now in the market. Still, it's more than your iPhone, but I think that taking pictures with the iPhone is the wrong way. I will admit, because really you cannot show most of the effect, and also the camera, when you take it too close, makes you look like a fish. The most important thing is what Ellen said: do this stretching test, do the pull test, record it on your camera. And also don't forget, because most of our colleagues take the picture from before and this is enough for them. No. I think you have to see from the profile, because when we change a degree to 45 degrees, then we see the tightening effect of the skin. Because when you look from the front, you see something is changed, but you cannot, tell or show the real thing. We have now tools to see the depth of the wrinkles, the hydration of the skin, but this is really advanced cameras. And I will be honest with you, the patient don't really care what they see on the camera. They want what they see in the mirror or feel when they touch the skin. Let them feel, let them palpate, recorded because of amnesia. And then you will get the full, let's say, responsibility for your patient. Also, I tell my patients, the thing that you got injected is not enough. You need to treat your skin and to do the right nutrition, which means drinking water, less caffeine. If I'm responsible on your quality of skin and fat components, you need to take responsibility also. So it is mandatory food supplements, using the right cream. If it's for the menopause, we need to think of something with estrogen, because the estrogen is one of the strongest stimulation for creation of HA in the female body. So we need to address this as a full package. You cannot come every 3 months for a treatment and expect everything will be nice. You have to relax a little bit, less stress. Stress is very harmful for our tissue. So I truly recommend some meditations in the morning for my patient. And by this, I'm taking them to the journey, because aging is a journey. It's a very long journey. You have to think how you can help your body. I don't like the word fighting, but slowing it down, because there is something also beautiful in aging, I have to say. But we need to feel good with our body, the way that we see ourselves in the mirror, the way the society sees us and responds to us. And there is a big place for aesthetic medicine, but we need to do it in a, let's say, ethical way. We need to know what we are doing to choose the right product for the patient, but still give them the full package, which means dermaceutical is very important. I tell my patient, I can put as many hydrating cream inside your skin, but if you will not treat the superficial layer, that will not be enough for you.
Yeah. So I guess with that in mind, Ellen, what are you prepared to do on the same day with Structura? A lot of people were doing Profilo and toxins together. What are you prepared to do in the one sitting?
In the sitting, as I said before, I will do Profilo 64 as well. We just alter the 1 point slightly, the one on the upper malar area. We change that slightly, and the other I will do botulinum toxin treatments on the same day for my patients as well. Being a little bit cautious about lower canthal lines, lateral canthal lines, because of edema, with the HA, with the botulinum toxin altogether, could cause a few issues with swelling.
Yeah. You mentioned that you sort of try and get your patients on a routine. So is this something that you might try and align or coincide with, so their toxin treatment every 3 to 4 months or every second toxin treatment? Have you kind of worked out what protocol works best or what patients are open?
So we try and do every second toxin treatment. And so they book every second treatment, they book an hour, and, instead of half an hour. And then we do the Profilo and Profhilo Structura together. Yeah.
What about using energy-based devices with Structura? Can you do it same day, Eyal, or lasers, or do you have a protocol where you separate the two?
Okay, with Structura is a bit easier. So because it is deeper, it's in the fat compartment, and most of the energy-based devices, except HIFU or very invasive radiofrequency, doesn't go there. So I can combine it at the same day. I will be honest with you that with Profhilo 64, I prepared to do the treatments with Profhilo before I start the energy-based devices. I tried it in combination the same time, and then I started to move into at least one treatment before. So when I use the energy-based devices and create the wounds, the wound healing process will be with less inflammation, so we will get a very nicer and safer results for my patient. And I've showed very nice difference in the effect when I use the radio frequency after the Profilo 64. HIFU is a bit different because it elevates the heat in the SMAS area for 72 degrees. So I will not combine it with the Structura at the beginning because this is a bit, it's using two modalities in the same area. I'm not sure it's the right thing. And you might also harm the product before it integrates into the tissue. So for me, energy-based devices are after the integration, and I give the integration in at least 2 weeks. I try to move my patients a little bit more and more from botulinum toxin. So nowadays we have the protocols for the foreheads and the temples with Profilo 64, and I can see that by improving the quality of the skin, the resistance to breakage, you need less amounts of botulinum toxin. And since when I do the Structura with the 64, I've changed the points of the 64. So I go a little bit more in the crowfeet area. So I will usually not do the botulinum toxin at the same treatment. But my patient know that I'm using less botulinum toxin, so they don't demand it as before. But honestly, the only thing that a young or less experienced aesthetic physician should think is that when you inject Profilo 64, it spreads. So be careful with combining it with the botulinum toxin. If you're experienced, you know exactly where to inject, so less chances of drooping eyelid, etc. So I would think about the combination. I will usually do the botulinum toxin when they are coming for the post-treatment pictures, after 1 month after the second treatment of both Profilos. Then I will do the botulinum toxin. But as you use more and more Profilo in the forehead and the crowfeet area, you need less and less botulinum toxin with time. And this is, I think, what is magic because, freezing our patient is not, it's a nice tool, but I prefer moving my forehead. And since we males have a much lower eyebrows, botulinum toxin is a bit, changing. It's more pronounced in our face than in ladies. So for us male, and since we respond very nice and even stronger than ladies to the Profilo 64. The forehead is, I think, the main area for where I can see that males have an advantage over ladies with Profilo 64. So, but you have to do it very gently, do some local anesthesia because women are less strong than ladies. We don't enjoy the treatment as they are. So you need to respect it and give some local anesthesia before. But these days I'm working with Profilo 64, even in the earlobes. Have you tried Profilo 64 in the earlobes?
Not in the earlobes, but in those annoying little lines right in front of the ear. I think it would
go even for the earlobes. Very nice. Sometimes you need to combine it with a filler if they come with a very deep line. But then you can keep them in a very nice situation only by using the Profilo 64 because the earlobe has not a lot of fat, but very most of it is connective tissue, so you get very nice effect from combining it with the 64. I totally agree that the lines in the preauricular area is very important place to treat because they are breaking quite fast when they are not getting the right treatment. And instead of stretching the skin, we can improve the skin. And this is something, if we think of, shall I use a lower cross-link filler or a skin hydrating product or a very diluted calcium hydroxyapatite, think of not creating fibrosis in this area, not creating artificial improvement. Let your biology work on it. And one of the best things is to, when a mother comes to me and she shows me a very interesting aging process, then I tell her, bring your daughter. Don't wait because fighting the result is harder than preventing the result these days. So it's very, very nice to look at the older version and then talk with the younger version. And then they bring their grandmother, and this is sometimes problematic. Then we have to combine it with surgery.
Ellen, if I could ask, I think I know the answer already from what I think I asked you when I saw you in person at the launch, but do you use Structura anywhere off-label, or are you sticking to lateral face for Saggers Sinker protocols?
At this stage, we're sticking to Saggers Sinker protocols, and the lateral face. We haven't moved to any other area yet. We're using Profilo 64 in the temples and forehead, as Eyal said, and some other areas, but Structura at this stage only in the mid-face.
Okay. How about you, Eyal? Anywhere else on the body?
Structura was built for the indication. It's not that they created the product and then they thought, where can I inject it? It is really different from other brands. So for the meantime, because we are addressing structural fat and the rheology and the concentration is tailored for the structural fat, we have to address the structural fat of the face. But when you understand how it works and you understand where in other parts of the body you have structural supportive fat compartment, you can think, and you didn't hear it from me, but around the umbilicus, for instance, on the abdomen, where the fat is more structural because more fibrotic tissue there. And IBSA will be mad with me. But think of areas with cellulite. And this is what I can say, but you have to be very careful and to learn the reaction of the body, because we know that with other brands, when we are trying to fight the cellulite, which is fibrotic tissue, we create an improvement, but on the longer time, we get a bit of worsening sometimes because we don't respect the biology of the process. So with Structura, think about it, like we found that Profilo 64 has improved really nicely acne scarring, because by doing subcision and putting the 64, we create a different healing process for the tissue. So think about using the same thing in order to give support for the skin from below for the cellulite. Still, you need to combine some modalities in order to improve cellulite. We don't have still a full solution using one product, but you should think about it. Many people ask me, shall I inject Structura to the temples? And I send them back to medical school for the anatomy course, and they have to check what type of fat is there. So for the meantime, Structura is not the right option there. But we are working on things, we are evolving. We get our friends from South America that really tries everything and they give us the result. It's at the end, it's all regulatory. So what you can do safely in the clinic, think, and since it's an HA non-cross-link, the chances that you will have complications is very, very low. Just understand, don't inject the neck with Structura because the fat component of the neck is thermoregulation. It's only to keep the heating inside. So going with Structura, when you have the safe and very effective 64, don't go there, like we say. But every questions we start to think, after every questions I get, I start to think, interesting. Maybe I will try it. But now that you have, when you got Profilo 64 to Australia and New Zealand, we didn't get the Profilo product because the factory couldn't stand the demand. So I believe that now, after the launch in Australia, we will again have the same problem. But IBSA bought another machine to create more products. So we hope it will be okay for us, because last time when you got it, I was 6 months without Profilo, and I was, what the hell is getting there? And I was really frustrated with you. This was the time I checked the competitors because I needed something for my patient, and I said, not good enough. So they all waited for almost 7 months.
Yes, our Australian listeners will be well aware what happened when Profilo launched. We just ran out. We were just using too much of it, and they just couldn't keep up with demand. But I did ask the question at the launch, have you made a specific Australian Structura machine so you're not going to have the same problem? And I joked, but they were serious. They said, yes, we've thought about that. So we shouldn't have shortages. Now, we'll just end with a couple of listener questions. This is from Sally Sutherland. She's a registered nurse here in Australia. I think you touched on this, Ellen, but let's just answer her question. If your patient already has normal mid or lateral face volume, would they be suitable to protect them from age-related fat atrophy, say an early perimenopausal woman? And at the launch, they said it's for everyone, but I'm nervous unless they're actually volume depleted. It's a good question.
I think it's a great question because we're always nervous of, overdoing our patients and also giving them procedures where they're not going to see value. So if they understand that this will prevent them from, especially if they're in that perimenopausal stage, if it'll prevent them from losing that fat, then absolutely yes, because that's exactly what it's going to do. Because as we all know, with estrogen, the loss of estrogen, you undergo a rapid depletion in the late 40s, 50s, and it can really be, in some people, quite accelerated. So to try and prevent that from happening, Structura is a great option. Yeah.
Excellent. Got a couple here from Dr. Simone Dorian down in Melbourne. Also one of our patrons. Sally's one of our patrons as well, so thank you.
Yes.
I think we've kind of answered the first two questions. Maybe I'll go to the third one in terms of the field of effect. So, like, how far does the product spread? I know Profilo 64 spreads quite a lot. And then she goes on to ask, is it only within the subcut layer and bounded by the ligaments with no travel beyond, or does it disperse more widely?
Yeah, it's because you're injecting it into the structural fat layer, so that's where it's staying. It might have its effect slightly on the dermal layer and the muscular layer, but it's not spreading into that layer as such. So yes, it can affect those layers on a cellular level, but it won't spread into those layers.
To build on that question, when Profilo 64 launched, they were saying very early on that it affects all layers. It's a multi-layer action, even down to bone. They were talking about bone, which was interesting. But so what does Structura do to those other layers, such as SMAS and bone?
Okay. We showed that it works also on the osteoblast and all the different cells in our, let's say, on our total face. But in order to address different tissue, we need to change both the concentration and the rheology of the product, so it will stay for the enough time at the right resistance for the tissue. So we know that the nanotechnology works on all the layers of the face, but we need different products for this. So it will be the same technology. It's like saying, I don't want to say any brands, but any HA filler company, and we have different types of syringes from them, different products. So you cannot do what you can do with a very low crosslink, what you can do with a high crosslink. So the same with the NICO technology. We need different products for addressing different layers of our face. And again, there is a but. Because we are changing the extracellular matrix of the fat compartment, we're improving also let's say, the quality of the ligaments. So we get more, let's say, one of the way that we get the lipolifting is not only because we change the fat cells itself, it's because we change also the connective tissue around it. So we get stronger ligaments, so we get more support. And by this, you can start understand why sometimes we go in front of the zygomatic cutaneous and mesenteric ligament and inject Structura in order to get the nice vectors of lifting. The same thing was with Profilo 64. We know that by injecting policies in the ligaments where it inserts into the skin, we get improvement of the tightening effect of the face. So from this, you can start thinking about how I'm going to change the BAP technique. And it's really amazing, like we say. But still, the BAP technique is very safe. This is why we don't have any vascular event, because we are far away from blood vessels, we are far away from danger zones, etc. The same thing with Structura. But for very capable injectors, you should start thinking what you can do with it. In Korea, they inject the jawline in order to tighten the jawline. Very nice thinking, I admit. One of the things I learned in Korea is to inject where the platysma ligament is, where it touches down below the auricle, where we use the threads, for instance, for fixating. So think if you can improve the quality of the tissue here, tightening and expressing more collagen in the fibroblast there, you will get a very nice tightening effect. So think when you use the Profilo 64, still there is a lot of place for Profilo 64 for sure, but with the Structura, stick to the right place for the meantime. When we will find something that we can show you, we will tell you. But for the meantime, remember where is the structural fat.
Well, excellent. I feel like I'm an expert now.
There you go. Fully trained. You haven't had it yet?
No, not yet. I will.
All right. Well, when I get my product in about 2 weeks, we'll get you on a bed and
we'll film it.
We'll film it for our Patreon. Thank you, guys. I appreciate you taking the time on a Sunday, your day of rest, to come and talk to us. You have to let us know when you're back in Australia, and hopefully we can catch up and learn some more pearls of wisdom and learn from your experience. But any final comments from you, Ellen?
It was fabulous when we launched Profilo, and we learned so much about that, and now following on with Profhilo Structura. And I think there's definitely more to come from IBSA in that direction. So I think we are going to learn a lot over the next few years, as new products come. But in the meantime, I think my best advice to people is to get your people into a routine of having these treatments done, and talk about investment in their future of their facial skin and their face.
Great. And any parting comments, Eyal?
So first of all, now that I know that you noticed that I'm a sinker, so I will come to your clinic to get my next Structura, because doing it to myself is a bit hard. I will admit. I totally agree with Ellen. When you understand that you want to keep your look and your healthy tissue as same, you need to maintenance it. You cannot get it by doing 1 to 2 year treatment. This is not the right way, even if it's the strongest product that the colleague says. You need to respect the tissue. You need to give it the healing process. You need to improve it, not fighting with it. So thanks for the innovation of IBSA. We get it now, and we will get many more products for different layers, as you asked. And the future is amazing, but the present is even more. The present is amazing. So use it in the right way. Keep treating with it. Don't try to get shortcuts by adding different things in the wrong place. So we moved from a lot of fillers to more bio-remodeling and then fillers. Fillers are still there and we need them, but biology is with us. So we use the biology in the right way, very safe, very nice results. And I have to admit, I was looking for a few years for something that will make me excited about the aesthetic field again. And Structura brought it to me. So I hope you will fall in love with it. Don't forget the pictures, like you said, the before and after, all the evaluation, and start using it the right way.
Fantastic. Well, thank you again. It's great to speak to you, and we appreciate all of your wisdom. See you later.
Thank you.
Bye. Bye-bye. For our latest news, follow us on Instagram at Inside Aesthetics Podcast. If you want to get in touch with myself or David, follow us on Instagram as well at Dr. Jake Sloan and David_Inside Aesthetics.
Join our Patreon for invaluable business and injectable education. Get access to our global community of like-minded professionals, live and interactive Zoom sessions, hints and tip videos, webinars, and more. Head over to www.insideaesthetics.com/Patreon for more information.